All right, welcome everyone. Let's talk about the introduction to our textbook, the Public Health Emergencies textbook that we'll be using as the basis of this course. So first of all, the book, as you may have realized already, comes in three sections, and the first section, part one, we'll call it, addresses the fundamentals of public health emergency preparedness. Gives us an overall perspective of public health emergencies, talking about the history, giving examples of, all these different emergencies that we've dealt with as a society. Many of you have lived through some of them already, have personal experience with that, maybe professionally as well. The book does a good job of using that to provide context for addressing the terms and the aims of public health preparedness. So there's a lot of terminology that we have to use in public health preparedness, especially as you get into some of these government programs, all these different acronyms with FEMA and CDC and ASPR. The book will do, a good job addressing those different terms and a lot of the language that we use. We try to keep it simple, I guess. So a big part of emergency response is fitting people into a response framework so that we can all coordinate well together, speak the same language when we're trying to accomplish the goals that are required by the emergency. There's a framework that we use called the all hazards approach, and you'll hear this term quite a bit. It's essentially just the idea that we will sort of set up this approach to all planning and preparedness activities in a way that seeks to find the commonalities within all emergencies. So whether it's a fire or a COVID response, some type of infectious disease, or a natural disaster, we're going to use a lot of similar tactics in our planning that's going to utilize systematic approaches. And the way that we deal with these emergencies, there's a lot of uh, unique aspects to each one, but overall, there's a lot of common ground that we have to use to address. That's part of the all hazards approach. So uh, we'll talk about the methodology. The book addresses the methodology of how do we develop and execute emergency operations plans. Within the government structure that I work with, the emergency management department within Riverside County, they work together with cooperating agencies to develop these emergency operation plans so that people can practice what's in that plan together and be familiar with what needs to be done in these different situations that we'll talk about throughout this course on how to address the foundational competencies of these different agencies, um, and how we can work together to plan better, practice better, and then ultimately respond better. So the second part of the book, talking about lessons learned, really builds on real world case examples. So things that have happened throughout history, most recently, a lot of the emergency response situations are given as case studies to help you see, and they do a great job of this in the book. Is really uh, it's funny when I've been reading this book. We used to use a different textbook for this course, and I really like this one a lot because this newer textbook incorporates a lot of the lessons learned from COVID. Even in the introduction, they do a great job at um, sort of reviewing the key elements that having worked through it. And experienced it, they do a good job with hitting on some of the deficiencies and things that could have gone better. Um, so these case studies, they help us look at the application of how the essential public health services, um, how those coordinate with the foundational competencies that, we as working professionals try to, you know, manufacture the skill sets to address the demands of the public health system. That would be the essential public health services. We'll talk about that in the next slide a little bit. Then part 3 of the book talks about special considerations, these cross-cutting issues that sort of multi-jurisdictional, multi-disciplinary response of emergency management. Public public health law is obviously a big part of that. I think we all lived through the most recent natural, at least the infectious disease, COVID-19 public health law. A lot of you could think of examples, I would imagine, where the law really impacted the response, using the tools of public health to, whether it's close schools or, in our case, we pretty much shut down society for an extended period of time, which had a lot of consequences that we're still dealing with today. So there's the public health law, whether it's immunization rules for schools, or taking people off work when they're sick. Those type of laws really are magnified in importance during an emergency and leading up to an emergency. So we spend a lot of time in public health thinking about how to use legal strategies to help us. A lot of these laws in public health go back decades and centuries, back to early days of cholera and yellow fever, those type of things. So very useful, but they have a lot of considerations that the book does a good job with addressing, the ethics and the impact of those decisions that we have to make as a society. Special considerations for vulnerable populations. One of the biggest issues during disasters, whether it's Katrina, there's a lot of good documentaries about this that highlight. I could recommend a few that really highlight the importance of addressing vulnerable populations and making sure that people aren't left behind, depending on their circumstances. Their ability to evacuate a situation, you know, is really crucial for planners and responders to deal with in a fair and equitable way. And obviously, public health, one of the reasons I love it, working as a public health professional, is that, it's always something new. There's new diseases emerging, new threats. A lot of them share commonalities with previous, previous situations, but there's always a new challenge that has to be dealt with, and we rely on our ability to learn from our mistakes to approach these future situations. So let's go to the next one. So let's talk about the essential public health services. Many of you have probably seen this graphic before. Essentially, with equity in the middle, helping guide all of our work in public health. We have these different activities. There's 3 core functions, which I apologize, my head might be in the way here. Let's see if I can move up. No, just kidding. But there's assessment, policy development, and assurance, and these are broken into 10 essential services within those 3 core functions. The assessment phase, we're really looking at how do we monitor the status, the population status, and the health of our populations. How do we investigate, diagnose, and address health problems? A lot of this would be with, the public health lab and work and professionals like myself who work on epidemiological investigations with teams of nurses and doctors. And how do we diagnose what's happening and investigate those, whether it's an outbreak or routine disease surveillance. We have to communicate effectively to inform and educate people. That's one of the biggest lessons that you will see throughout the majority of these case studies and definitely lived experience that I have, that many of you probably have, even in our own relationships. Communication is always one of the biggest uh, difficulties, I guess, but it's also the best opportunity for us to share information. What do we know about what's happening, and making sure that people uh, are equipped with the right information to make their decisions. We have to strengthen, as one of the other services, strengthening, supporting, mobilizing communities and partnerships. This one is essential to public health and um, emergency response in particular. There's no better ways to build a resilient community, which we'll talk more about that, what that means, resiliency, than to have a good network of uh, a social network of partnerships between agencies. And then we'll talk more about implementing policies. This is one of the things maybe some of you are interested in. I definitely have an interest in it as an epidemiologist. How do we use data to help us create the right policies that will, you know, cause or at least help improve the health of our communities at a broad level? Policies really make a big difference. I'm sure a lot of you can think of different examples, whether it's um, during disasters, whether we have policies related to masking or vaccinations or social distancing, those type of things. But on a daily basis, whether it's car seat laws, seat belts, clean water regulations, all those type of things really, and that gets us into the legal and regulatory actions part of the cycle. And obviously, enabling equitable access. That's one of the hallmarks of public health, is trying to ensure that everybody has an opportunity to achieve their optimal health by having those resources, the access they need to things that uh, can keep them healthy. A diverse and skilled workforce, that's what we're all here for right now, is to try to educate ourselves, build our skills so that we have a perspective within public health that draws on different backgrounds, ideas, and skills. So, and obviously, we're always seeking to improve, innovate, and use research. A lot of public health emergency response is actually built on, especially in planning phases, where we're looking at research to help us guide decisions about what might be done, whether it's how effective, what are some effective measures for reducing the spread of illness from airborne infections, for example. Um, we need to build and maintain strong public health infrastructure. And this is one of the great, I guess, silver lining aspects of COVID. As bad as it was, it really drew attention to the deficiencies in the public health system. I've been able to see that firsthand, how we've received a lot of funding to help us address deficiencies in lab testing, um, technology like that, whether it's data systems to monitor and track these illnesses, wastewater surveillance. There's all kinds of different things that have been a result of public health emergencies drawing attention to the need for strengthened public health systems. So next, let's talk about, let's pause. Next, let's talk about how the foundational competencies that you all are responsible for completing as part of your education as in the master's program. These were designed by the Council on Education for Public Health. They group these competencies. This is another graphic here that illustrates these domains, similar to the essential public health services. There's domains of foundational competencies that we all need to meet as professionals within uh, public health. How do we use evidence-based approaches? How do we, use the healthcare systems, planning and management to promote health, policies again, leadership. Obviously, we all want to develop our skills as leaders, teachers. How do we guide public health forward? Communication again, as I mentioned, is one of the foundations of our work. How do we, make sure that we're sharing information with community members in a way that and not just community members, but to each other through our professional networks, working within different sectors, different collaborations. Public health is always one of those disciplines that really relies on our ability to bring people to the table, so to speak, and generate action and momentum by leveraging the strengths of different sectors within our society, whether it's education, law enforcement, economics. All those things really are foundational to public health. Systems thinking ties into that. We need to look at public health as a how do we fit into this larger system and use our skills to leverage the skills of others, and the resources that we have available. So I won't go into every single competency. You may have seen those already, but each of the 22 competencies fits into the one of those domains, and it helps us prepare for the professional environment where we all ideally would be able to work together using these skills. And I guess the distinction here is that foundational competencies, to me at least, we're talking about the individual abilities. What do we bring to the table as individuals to fit into the essential public health services that are sort of the unifying activities of the broader public health systems. So, we bring these skill sets into the system to work towards those essential public health services, and we're not able to do that effectively unless we have these individual competencies. So let's highlight real quick the learning objectives that are sort of compressed into this book and as part of this course in general. Public health emergencies, we want to understand what a public health emergency is. We need to talk about, what do we mean by community readiness and resilience? How do we define what that means? And typically, within our operations planning, how do we decide when a community is ready and resilient enough to withstand and deal with disasters as they are presented? So We'll talk quite a bit about that. That's these objectives sort of sequentially move through the book. We'll be gaining knowledge of the major agencies. Just getting to know the structure of who all these responders, what their roles are. Public health at the local level. I have a particular role, and my agency has a role to fill in these disasters, and we will talk about who does what and who they are. Knowing the approach to designing all hazards preparedness plans. I mentioned that a little bit, how we approach the disaster management and planning phases by looking at, how do we prepare ourselves at a basic level, or all the way to an advanced level to deal with all these different types of, never-ending list of hazards that we have to deal with. So, what are the commonalities and the sort of the unifying threads through all these emergencies that we can address together in our planning? Acquiring an understanding of the approach of how to assess disaster risks. This is a lot of what I do as an epidemiologist, using data to look at, and there's more tools for this than ever. And I will share some of those throughout the course that I use on a daily basis. How do we assess, using information that we have available to decide what to to focus on at any given moment, and how to plan for what might happen down the road, based on scenarios and data modeling, those type of things. So, understanding how to develop an emergency operations plan. There's different levels of planning that we develop pre-plans to address emergencies and all a hazard style, but then there's sort of a rhythm to how you develop plans as a disaster is unfolding. How do you adjust and respond? There's a whole science basically behind being able to organize people and come up with manageable objectives during emergencies. That's a whole field within itself, but we'll address that as well. Knowing how to apply public health law, mention that quite a bit, different scenarios that we have and the tools that public health has given to it by authorities that we have, whether it's a health officer or the governor, so forth. Recognizing the unique needs of vulnerable populations. I mentioned that a little bit already, how crucial that is. The 10 essential public health services and how they fit into disasters. Public health services, we deal with we address them on a daily basis, but whatever we do on a daily basis with our essential public health services is really magnified during a disaster and sort of compressed in a way that really draws attention to how vital those services are toward maintaining order and the functioning of society. They break down real fast if we're not addressing those things. So, foundational competencies, already mentioned that quite a bit. And then determining the level of staff needed to utilize those competencies. So, that's a big deal, especially during a disaster where you may not have people available. People may be sick or affected by a disaster that you depend on, and how do you fill those gaps is a big reason why public health professionals in particular, we are cross-trained in a lot of different disciplines to be able to fill those. We have those foundational competencies. We can fill into those roles as needed during a disaster. So, and just gaining a level of confidence and being able to serve in a public health disaster. Knowledge is power. Being I remember the first few times and still to this day, every time there's a public health disaster, it's stressful, and but it definitely gets less stressful and more manageable as you build more experience. And hopefully, this course will help you develop a certain level of confidence about being able to speak the language of disaster management and understanding what may be involved. So that's the bulk of the introduction. Sorry, I went a little long there, but I think it's valuable to discuss, um, what's ahead with this book and the course. So I will see you all soon.